A stroke can happen in seconds, but its effects can last a lifetime. The scary part, most people miss the early signs, especially seniors. That's why today Dr. Panda is here to make sure you know exactly what to watch for, because catching a stroke early can mean the difference between recovery and disability, or even life and death. Let's dive in. The first sign, sudden numbness or weakness, especially on one side of the body. If your face, arm, or leg suddenly feels numb or heavy, and especially if it only happens on the left or right side, don't wait. Call emergency services. This is one of the most common stroke symptoms. The second sign, confusion or trouble speaking. If you suddenly can't understand what someone is saying, or if your words come out slurred or jumbled, it's a red flag. You may still feel alert, but your brain isn't sending clear messages. That's a stroke warning. The third sign, trouble seeing in one or both eyes. Blurred vision, black spots, or sudden loss of vision can all be signs of a stroke. It may feel like you've just been staring at the sun or a camera flash, but if it doesn't go away quickly, seek help fast. The fourth sign, dizziness or loss of balance. If you suddenly feel unsteady, can't walk straight, or feel like the room is spinning, it's not just aging. It could be your brain sending an alarm, especially if this happens with other symptoms. Sign number 5, a sudden severe headache. Not just any headache, a sharp, painful, out-of-nowhere headache that hits you hard. It could feel like the worst headache of your life. This can be a sign of a hemorrhagic stroke, where a blood vessel in the brain bursts. Time is everything. There's an easy way to remember these signs. F.A.S.T for face drooping. A for arm weakness. S for speech difficulty. T for time to call emergency services. The faster you act, the better the chances of survival and recovery. Stroke treatment works best within the first 3 hours. After that, damage can become permanent. Now, what can increase your risk of stroke? High blood pressure, smoking, diabetes, obesity, lack of exercise, and high cholesterol. The good news? Every one of these can be managed. If you stay active, eat well, and keep your doctor informed, you lower your risk dramatically. Here's the bottom line: strokes don't wait, and neither should you. If you or someone you love shows any of these symptoms, act F.A.S.T. Share this video with your friends and family. It could save a life. Dr. Panda is here to help you stay informed, prepared, and healthy at every age.